Ladies and gentlemen, I'm welcoming you, everybody, to ProMab's very first webinar. We are starting a new webinar series, and the first webinar is going to be about the comprehensive CAR T cells against solid and hematological cancers. Today's webinar speakers are, well, myself, I'm the host. My name is Dr. Evelyn Sakal. And our featured speaker is Dr. Robert Berahovich, who is the director of the CAR T technology at ProMab. I'm just gonna give you a little overview so that you know what to expect in this webinar. A little bit of introduction of ProMab Biotechnologies. I'm gonna talk about 5 to 10 minutes about that. Then Dr. Robert Berahovich is going to talk about the custom CAR T cell development so that you get some information about it and you can ask questions in the Q&A session afterwards. If you have any questions, please submit your questions to the Q&A box, which is on the bottom left of your Zoom screen. Something about ProMab's mission. ProMab was founded in 2001. ProMab is located in the San Francisco Bay Area in Richmond. And its mission is to serve the biomedical research community, both locally and globally, to advance immunotherapy against cancer. ProMab already has gained more than 20 years experience generating highly specific and potent monoclonal antibodies. And in the last 5 years, ProMab started creating and using CAR T and CAR NK cell technologies. Thus, ProMab became the first CAR T CRO in the world. ProMab has published many peer-reviewed publications in peer-reviewed journals. This is from the R&D team that I'm showing to you, and there's more. Also, ProMab has published the book in immuno-oncology, and if you go to this link that I'm showing here, you will see it on PubMed, and the title is Generation of CAR T Cells for Cancer Immunotherapy. Robert is one of the authors in this book. Also, ProMab's clients are publishing in prominent journals. I just tagged up a lot of these publications. Unfortunately, I cannot show you them one by one, but I can send out a list if anybody is interested. And ProMab's key products and services. So ProMab's products include primary antibodies, full-length proteins, CAR T, CAR NK products, cell isolation kits, cancer stem cells, primary leukocytes, which are either fresh or frozen from healthy donors, or not from patients. Then ProMab also offers a list of services, which are the following: custom antibody engineering, custom CAR T or CAR NK cell line engineering, protein expression, cell-based assays, including flow cytometry. And ProMab is planning to set up a GMP site in 2020 in Alameda for manufacturing CAR T for clinical studies. If we talk about the custom CAR T, ProMab is doing out-licensing and distributing of the CAR T cell technology platform, as well as ProMab is developing custom CAR T and custom CAR NK cell lines, as well as supporting animal studies and cancer stem cell research. Just a few words about the customized CAR T generation for cancer immunotherapy. In the last 5 years, ProMab has developed more than 60 types of off-the-shelf CAR T cells, more than 15 types of engineered target cell lines, and ProMab has more than 20 patented innovations. To add to this, ProMab has the ability to construct a CAR based on the following: patient's antibody sequence provided by customer, a mouse monoclonal antibody, or based on a fully human single-chain variable antibody fragment from ProMab's existing library. So the next in our presentation, Dr. Robert Berahovich is going to talk about the custom CAR T cell development. And after that, we are going to have the Q&A session. So I welcome Robert who joined us. Let me just give you the floor by making you the host. Here you go, and then you can share your slides with the audience.
Hello, everybody. I hope you can see my screen. Let me start it for you. Okay, so today we're going to talk about ProMab's custom CAR-T program. And when we talk about the program, we generally divide it into phases. We have 5 phases currently. The first one is antibody production and isolation. Phase 2 is antibody sequencing. Phase 3 involves generation of the single-chain variable fragment and production of lentivirus. Phase 4 is generation of the CAR T cells themselves. And the 5th phase is analysis of CAR T cell function. So I'll just talk a little bit about each phase. Phase 1 is if you don't have an antibody, but you know the antigen, we can generate the antibody for you, either using traditional monoclonal methods in mice, or as Evelyn noted, we can screen our human antibody library. We can also, and this is totally optional, we can do some characterization of the antibody in vitro. We can measure some properties of the antibody by Biocore. We can look to see what cells the antibody will bind to by flow cytometry. And we can also look for binding of the antibody to tumors or tissues by immunohistochemistry or immunofluorescence. Here's some of our representative data. Let's see, here up in the upper left is some immunofluorescence staining HEC293 cells that have been transduced to express the BCMA protein. And then this is staining in green with BCMA antibody. Underneath that is some flow cytometry data where the x-axis is the amount of staining, and the orange histogram shows staining of the BCMA antibody to the cells. I believe these are multiple myeloma cells. And then here on the right is some Biocore data showing association of the antibody with the antigen, and then dissociation when the antigen is washed out. Phase 2 is fairly straightforward. It's just sequencing of the variable regions of the antibody's heavy and light chains. This is done on DNA from the hybridoma. This takes about 4 weeks. And if you want, we can humanize the sequences for you. In phase 3, we first make the scFv based on the antibody sequences. If you want, we can produce the scFv protein and test it in vitro by flow cytometry or other methods for binding to the target antigen. Then once we make the scFv, we can clone it into a lentiviral vector containing a CAR cassette. And here you have options. You can choose the type of CAR you want, the type of the generation. You can choose which co-stimulatory domain you want, which promoter you want to drive high-level expression versus low-level expression. And you can add additional elements such as a suicide tag, a suicide sequence, or a tag, either under the same promoter as the CAR or a different promoter. And then lastly, once we have that CAR vector, we go ahead and produce lentivirus transiently in HEC293 cells, and we collect the virus. We can purify it normally, or we can do a very high purity virus collection using tangential flow filtration, and then we can titer the virus either by qPCR or by infectivity. In phase 4, we generate the CAR T cells. We first activate T cells with CD3 and CD28 antibodies. These T cells can be purified. They can actually be divided into T cell subsets, or we can use T cells in whole PBMC, which is the fastest and cheapest option. We can remove other cell types from the prep to improve the CAR T culture, and we can do multiple donors at one time. Currently, ProMab has about 15 PBMC donors frozen down. So we activate the T cells, we transduce with lentivirus, and then we can expand over 7 to 14 days of culture. The longer you go, the more cells you get. If you need hundreds of million cells, we use G-Rex containers. And then at any point during the culture, we can analyze the cells to see what percentage of them express the CAR, and we can also do flow cytometry to characterize the CAR T cells, CD4 versus CD8, naive versus memory. And here's some representative data. So on the left is staining, x-axis is the flag tag, y-axis is CD3. So on the left are mock CAR T cells. This is a construct we've developed in-house. On the right are CD19 or flag tagged anti-CD19 CAR T cells. And so you can see in both cases, the y-axis, the CD3 antibody stains almost all the cells, but the flag antibody only stains the CD19 flag CAR T cells. We can also use, if the CAR is not tagged, we can use a tagged ligand to identify the CAR T cells. So in this case, on the x-axis, we're using biotinylated BCMA protein, and that protein only binds to the BCMA CAR T cells here on the right, about 1/3 of the cells. And we have these tagged proteins for a number of different CARs. And then lastly, for this phase, I just want to show some flow cytometry data using CD62L on the x-axis and CD45RA on the y-axis. We use these two antibodies to phenotype the cells, differentiation phenotype. So naive T cells are up here in this upper right quadrant, and as they differentiate into central memory T cells, they're down here, and they further differentiate into effector memory cells in the lower left quadrant, and the most terminally differentiated are the effector T cells in the upper right. And I just show you the data here from 2 different donors, showing that there's a lot of donor variability in the differentiation phenotype. And this is how we quantitate the data. We actually show you the percentages of each subset. And actually in this experiment, this shows that changing the BCMA CAR, humanizing it, does not change the differentiation phenotype very much. So the last phase, phase 5, is where we analyze our CAR T cells functionally. So we have 3 assays. The first one is the cytotoxicity assay. We can use, if the target cells, the cancer cells are adherent, we can use a real-time assay, the RTCA, which I'll talk to you about in a moment. If the target cells are not adherent and they're in suspension, we use a lactase dehydrogenase release assay to quantitate cytotoxicity. The other assays are cytokine production. So when CAR T cells encounter antigen, they release gamma interferon, IL-2, and a number of other cytokines. We can measure these by ELISA, or if we have a lot to do, we'll use our Luminex machine. The last assay is checkpoint protein upregulation. When CAR T cells are activated, the signaling through the CAR causes checkpoint proteins, PD-1 and LAG-3, TIM-3 and TIGIT to be upregulated. We can measure this by flow cytometry. So here's a representative RTCA assay. This assay uses the adjuvant excelligence technology, where a minor electrical field is applied to the target cell monolayer, and the impedance of the monolayer is measured in real time, and that's on the y-axis, the impedance. So the greater the integrity of the monolayer, the more impedance it will have, the more it will resist electrical signal traveling across it. At this bar here, this vertical bar is when we add our effector cells to the target cells. Now, if the CAR T cells here in red kill the target cells, they open up holes in the monolayer, and the current can run through the monolayer much faster. And so that's what actually happens, is you see that the impedance of the monolayer decreases over time as the cells are killed by the BCMA-specific CAR T cells. The control cells, either non-transduced T cells or T cells expressing the mock CAR, do not kill these TRO-BCMA target cells. And if you look here on the left, we can quantitate cytotoxicity at any point during the assay. And the only times we get significant killing is when you have both TRO-BCMA target cells and BCMA-specific CAR T cells. This is also seen when we analyze these media for gamma interferon levels. Gamma interferon is only produced when you have both the target on the cancer cells and CAR T cells that are specific for that target. Here's an example of our checkpoint protein upregulation assay. So here on the top, we've got K562 target cells, which do not express BCMA. On the bottom, we have MM1S target cells, which do express BCMA. On the left here are T cells, control T cells without the CAR, and on the right are the CAR T cells. And it's only when you have CAR T cells and the target, so down here in this bottom right quadrant, or in this bottom right figure, that you get a lot of checkpoint protein upregulation. You have a lot of cells in this upper right quadrant. These cells express both PD-1 and LAG-3. You don't get these cells when you're looking at any of these other three plots. And this is just the isotype control plot showing that there is some background LAG-3 and PD-1 expression on the T cells and CAR T cells. Now, we do have quite a large animal facility, and we can do mouse tumor studies. We don't include these in our in vitro phases, for obvious reasons. But if you want, we can certainly do either solid tumor studies or liquid tumor studies. If we do solid tumors, we will do them under the skin, and we use calipers to measure tumor volume. For liquid tumors, we use luciferase imaging and quantitation. Before I show you some data, we can also analyze the mice in a number of ways besides looking at tumor load. We can do flow cytometry on cells in the blood or the tumor organs. We can measure cytokines or other solutes in the blood by ELISA. And we can analyze tumors or organs by immunohistochemistry for cancer cells, leukocytes, apoptosis, or other activities. So here's an example of a solid tumor model. This is a multiple myeloma, RPMI 8226 BCMA-specific tumor cells growing into tumors under the skin. And then at these arrows here, twice during the 7 weeks or 5 weeks, we inject our BCMA-specific CAR T cells, and that causes the tumors to shrink and disappear, whereas if the effector cells are mock CAR T cells, the tumors just keep on growing. And then this just shows visually the sizes of the tumors at the end of the study. For liquid tumors, we will use luciferase. In this case, this is luciferase expressing Raji cells that express CD19, and we do bioimaging once a week over the course of the study. Mice that receive the Raji cells, the Rajis spread throughout the mice and expand, and that's shown here in this heat map. On the top is just the vehicle-treated mice. Second row are the mock-treated mice, and then the third and fourth rows show two types of CAR T cells specific for CD19. So these react with the Raji cells and prevent them from spreading and taking over the mice. And this plot here on the right just shows the quantitation of the luciferase signal. And you can see that there's a lot of signal here with the mock CAR T cells, but our two types of CD9 CAR T cells block tumor cell spread. Thank you much for participating in this webinar, at least in this scientific part of the webinar. If you have any questions, why don't you please please put them in the Q&A section down below. In addition, if you have any questions, I don't think I have, yes, I don't have Evelyn's email. Let me transfer the control back over to Evelyn, and she can give you her email address.
Thank you, Robert, and thank you everyone for participating in this webinar. And I see that actually there's two questions here. So the first question is approximate cost range to develop CAR T based on antibody sequence. Robert, would you like to answer this question, or shall I go ahead?
I can answer it. The costs really vary a lot based on what you need done. It depends on which phase you want, and then the amount of assays that are involved in each phase. The minimum, as far as just making CAR T cells based on your SCFE, probably would only run about $5,000. If you have more things involved, you'd want to talk to our technical liaison, and she can give you an estimate.
Thank you, Robert. So the next question is, approaches used for off-the-shelf therapy, any used in clinic, meaning in patients already?
I can answer this as well. We have our own internal research where we are examining off the shelf, but it's pretty far behind autologous CAR T, so we're not ready yet to extend that to our customers.
Okay, so maybe we can go to the next question. Oh, thank you for the talk. Thank you for the remark. You're welcome. How many CARs is it possible to add to T cells?
We have only tried 2 CARs. We've been successful at 2. We have not tried to express 3 CARs at once, but 2 is certainly possible, either separately or in a tandem fashion.
Mm-hmm. Also from the same person, the next question. Also, do you have any thoughts on how to improve persistence of adoptively transferred cells in solid tumors?
We do, but I don't think I'm at liberty to disclose that. If you'd like to talk to us about it, I encourage you to get in touch with us, and we can put you through to the correct person to talk about that.
Thank you, Robert. Next question. Let's see if any other open questions. Can you generate human antibodies directly, bispecifics, for example?
We do have a human antibody library, and that can be easily screened. We also can generate bispecifics, and we actually have some we're working on right now. If you're interested in that, just let us know and we can discuss it with you.
Okay. Looks like there's no other questions here. So what I want to do is I'm going to show you now my let's see. Yes, my email address. So this, I'm going to share my screen again with people, and if anybody has...
Oh, there's one more question.
Oh, okay. So can you generate FcRn modified antibodies?
You know, I actually don't know about FcRn modified antibodies, so I haven't heard about it, but the other scientists may be able to help you with that. So just contact us with that question.
With that, I thank you again for your time. Thank you. I know everybody's really busy and would like to get back to work. So thank you very much for attending, and thank you very much for your questions. I think we are adjourned now, and I hope to talk to you again sometime in the future. Thank you. Bye.
Thank you. Bye-bye.